we can all agree that, long-term care homes and healthcare workers should be the priority. I think the discussion here is that there really is no discussion around kids like mine, which is, almost 1 million kids with medical complexities like my son.
While Canada gears up for the first rollout of a COVID-19 vaccine this week, many parents and health professionals are sounding the alarm. They believe that the vaccine plan misses the mark when it comes to children. Concerns being raised include making sure there's a plan and timeline in place to vaccinate children safely, and questions about when parents and caregivers of medically fragile and disabled children will be vaccinated.
And when a vaccine does become available, a kid-safe vaccine, we need to ensure that Canada is ready to obtain, to secure that vaccine, and then to administer it to children and youth across the country.
Bruce Squires is also the chair of the board of directors of Children Healthcare Canada. He says serious issues can arise if this isn't done properly and in good time, which means protecting those who work in the vulnerable sectors of schools and childcare.
Where you're forced to shut down those in-person learning opportunities. We've seen how significant that impact is for the physical, the developmental, the spiritual, and the mental health of children and youth. It truly does affect their futures.
Board healthcare professionals and parents are weary about what the proposed idea of immunity passports could mean for children who may have to wait in line for their turn.
As parents, especially as parents with kids with medical complexities, we're already very careful, probably more careful than the general population to really minimize our exposure to COVID. So having something that is going to, segregate us from the community even more by having these passports, I think is really the wrong move.
Children's Healthcare Canada tells CityNews that they understand there is a complex effort to roll out the vaccine to Canadians, but believe it is imperative that children and youth are made a central part of this strategy to keep them safe in a pandemic that spared no one. Brandon Rowe, CityNews.